It is Senator Derrick Simmons, my man, Senator District 12, Bolivar, Coahoma, Washington County's chairman of the Senate Democratic Caucus. Good morning, Senator. How are you?
Pretty good. Good morning.
You forget about us?
I did not. I just never got the link.
Oh, you couldn't? Oh, well, that thing's kind of touchy. So I like it better on the phone, so I'm glad you didn't. Well, but one way or the other. Look, I wanted to get you on for a couple of reasons here. Number one, you had a recent statement that you sent out in support of State Health Officer Dr. Dobbs, and where did that come from? What was the necessity, and your thoughts on that?
Well, Dr. Dobbs is under a lot of attack. We, as legislators, started receiving a lot of calls and a lot of emails petitioning for his termination. And I just thought they were unprovoked attacks on him. And, we all have dealt with this pandemic for almost 2 years or certainly over a year. And decisions have had to be made in our individual lives and certainly in our professional lives on what we should do during this pandemic. And I know he has also made these tough decisions, and I just know that he has done everything in his power to try to help us recover from COVID-19, and now we're dealing with the Delta variant by trying to get everybody vaccinated. So I just wanted to send out a statement, a public statement in support of him.
I don't know if you heard, the Chief Justice was on in the studio with me a few moments ago. He was talking about some new numbers. But when you start talking about 95 to 97% of the people who are now in the hospital or who have come down with this have not been vaccinated, I don't know what it's going to take to get the people. It's just a shot. It's not that big of a deal. Get her done. It's free. It's fast. And I could say the same thing about the flu shot or shingles or anything else that's available to you.
And for a long time, I did not take the flu shot. So I certainly understand people hesitancy about, taking a shot. But I know now I've been taking the flu shot for about 10 years. And I agree. I mean, it's just a shot. I didn't get really, really ill on the first one. On the second shot, I did get a little ill for maybe like an hour or two. But, I bounced back. And when you look at all of the data supporting how it certainly reduces the extent of your illness if you catch COVID and certainly will preserve life, then I'm trying to tell everybody, including my constituents back here in the Delta and even family members, how important it is to take the shot.
What does it look like as far as the number of people in the African Americans in the Mississippi Delta that have not had it? Have you seen some numbers?
I have not, but I know the number is across the board. It stretches across racial lines, party lines. It's the same. It's like there's a pretty large percentage of people in Mississippi who are not taking it, and it has nothing to do with really race or ethnicity or party. We just need to get it done. I think the numbers, we're about 30. What about a little more than a third or right at a third?
I think it was closer to 40%, but you are right. Early on, and I'm not sure if these statistics have changed, but early on we were told that the number of African Americans to Caucasian Americans who had gotten the shot was basically the same, and really didn't have any distinguished numbers as far as black or white in the state. We got a problem that we just have too many people who haven't taken it.
That's right. And out of 3 million Mississippians, I think we were right above 1 million or something. So we at about a third. I agree, about a third to 40% of people who've taken the shot, but we just need to get that up to 50%.
I agree with you. I don't know how we do this as fellow Mississippians. Forget about party, forget about race, forget about gender and everything else. We are Mississippians and children of God, and and I know this is tough now more than ever before because of social media, Instagram and Twitter and TikTok and Facebook and all the other things that we have, all of the stuff that's blaring, all of the politics from all of the news media on TV and things. But if we just stay there silently and think, the best thing for us is to take the shot and then march on. I mean, it's when you start looking at the statistical data we have. I don't really know. I have a lot of questions about the mask, and I can separate those things. I think when we're in some heavily traveled, I'm sorry. Go ahead.
Well, I was going to say, just back to the shot. I know we all have been touched personally as it relates to this pandemic, and I've had 2 family members who have died as a result.
Jeez.
And then also when I look at the fact that I have a 7-year-old and a 2-year-old who have started school on yesterday, and it's one of those things where I want those daycare providers and I want those educators not only to be vaccinated, but also I don't want my 7-year-old to catch COVID again because he already had it. So my 7-year-old already had COVID, and my wife had COVID. And so I was able, fortunately, not to get it even when we had the outbreak in the legislature. I was fortunate, and I thank God that I didn't get it. My 2-year-old, he didn't get it. But, I mean, it was a challenge for me and my family at the time as we went through those deaths as well as that illness. And so I'm one of the ones that believe that you should get vaccinated, and until we can get our vaccination rate higher, we should be wearing masks. I really do believe that. And I know you're saying you can separate the two, but I just don't want it to be a situation where someone who has it gives it to my 7-year-old, 2-year-old, and then they bring it to me, and even though I've been vaccinated.
Well, I think I will speak to this, and I think it mirrors a lot of other people. We have no problem with that at all. In some cases, I've had the shot. If I'm in an area I feel like I don't want to wear the mask, then I've had my shots, and that should be my choice, that I'm not mandated to wear the mask. But then again, you couldn't have found a subject to tear us apart more as a fellow Mississippians, and this one's done that. And in some cases, we've let people do it to us.
Yeah, well, I just like to follow the science, and I will admit that I take my mask off when I shouldn't be taking my mask off, even in those indoor large gathering settings. If you have to go by the CDC guidelines and Department of Health guidelines. And my wife is more adamant because she actually is a scientist by profession, and she's more
Oh man, you better listen to her. You're in trouble. Hey, could you hang on? Can you hang on for a second? Can you hang on for a second? I got a couple of other questions.
Okay, yes, sir.
Okay, hold on. Derrick Simmons going to ask you about some other things that are outside the scope of COVID. We'll talk to him. Haven't had him on in a while. Senator District 12, Bolivar, Coahoma, Washington counties, chairman of Senate Democratic Caucus, and he will be Mr. Chairman. It's Derrick Simmons. Speaking of chairman, he's chairman of you're chairman of municipalities, aren't you?
I am.
What do you think the different mayors are thinking out there as far as the way you guys are going to fashion this medical marijuana bill?
Well, MML, they took a position early on. They had an issue with the zoning, and they certainly had an issue with the sales tax diversion because they didn't want dollars actually, being generated in their various municipalities, and they not actually getting a piece of the pie. And based off a lot of the projections, a lot of money is going to be made. And so I just think that their position is the same. We had a MML conference on the coast last week. The new president is Greenville Mayor Eric Simmons. He got the gavel from my good friend Gulfport Mayor Billy Hughes, who I served in the Senate with before he became mayor. And so their position is the same. They want to just try to make sure it's regulated by the state and taxed by the state so that they can get their portion.
What do you think the appetite is as far as the tax on this? Because I mentioned something yesterday, and everybody wants to look at this, and I know the House does, and there's some resistance in the Senate as far as the personal income tax. But that's going to come back, And the Senate's going to have to make a decision on this because the House is all in on it. I'm not sure what you guys are going to do, or if you're on the committee that's supposed to be either about to get underway or underway as far as the Senate Study Committee. Are you on that committee?
I'm not on the Senate Study Committee, but when we were in session this year, the bill, once it passed the House Bill 1439, it came over to Senate Finance. It was referred to the Senate Finance Committee, and I was on that committee. And I was one of the ones who took the position that this is such a major issue that we should study it. We are talking about a complete overhaul of the tax system. And so, yes, we do know it's being pushed heavily by the Speaker and the House. And so I think it's going to be an issue that we are not going to avoid, but certainly Democrats, Republicans all agree on the Senate side. I mean, I just couldn't name one senator who said we needed to do it this year. And so I believe that's.
But you're not saying that they don't think that it could be taken up in the next session.
I'm not saying that anybody made a decision on when it should be taken up.
Right,
it's just that in the 2021 session, I couldn't. There would not.
I don't disagree with you. I think it was too fast, and I think the House should have at least worked with you guys and had somebody, a liaison from the governor's office, and you guys on different committees are working together to put this in the 2021. So, and I understand politics. Don't get me wrong, but I'm looking at this. What the magic here is. How do you find the tax dollars that are coming in that you're not taking from the Mississippi people's working paycheck and letting them have this? How do you supplant that for the state revenue? I mean, that's the key ball of wax right there. Who do you put that tax on? And we know that the resistance has come from the farming community, from more corporates. We understand all that. Not an idea, but I brought this up yesterday. We are on the precipice of passing medical marijuana. I don't know how we're going to get out of it. I think it's a bad deal unless we do it very restrictive. But there's going to be some money coming in from that. We also have a very healthy casino industry in the state, and we've been very good about how we've put that industry together. And they, all the way from the lottery to that side of gaming or gambling to the casinos themselves, is it time to say we could tax maybe a couple of extra percentage points on marijuana to 9% and also increase the taxes on the casinos, not to be restrictive, but that would supplant that money?
I think that's a very good proposal. Not to say that without it being fully vetted that I support the proposal.
Yeah, but is it something worth studying?
It's something worth studying, and I would say my biggest concern about when we start swapping taxes or eliminating taxes is how do we still support the vital functions of government? How do we fund vital functions of government? Because we still have to have health care. We still have to have education. We still got to fix our roads and bridges. And so my concern is as long as my expenses, if they're going to stay the same and then my income is staying the same in my household, and my wife I got to make sure the lights are on and I got to make sure food is on the table, if I can still fund those things, then I guess I'm okay.
Well, in the proposal, Senator, that was put forth by the Senate, by the House, you had a cut of grocery taxes, so that was going to be a tremendous savings. It was all the way from no grocery taxes to a cut in grocery taxes, so that added up to literally hundreds of dollars a year. And I think even on the first scale, it was about a $1,400 a year savings that people were going to be able to see in there. So, they could spend that at a casino or they could spend that at the medical marijuana shop.
Yeah, but the consumption tax went up. Like this, the sales tax on all other consumable goods went up, and you had the farmers who opposed that. You had Farm Bureau who opposed it, of course. And so you had a lot of people who felt like it was regressive in that if I go to I can go to the grocery store and I can get a reduction on my groceries, but then if I actually go to Lakeland, or I go to the outlets of Mississippi and I want to buy clothes for the sales tax weekend. Well, the sales tax weekend is exempt, but any other weekend other than the sales tax weekend, I got to pay 9%.
I understand it, but the hard thing to tell people is you're not going to buy a car or a suit every day, but you will buy groceries every day, and you're going to get money back from the paycheck that's not being taken out. So, I mean, it does work out in the positive, but it's hard to make that sell. Well, look, your thoughts on the vote? Should we have a special session for this medical marijuana or not?
I think we should. I think that after 74% of Mississippians voted in the November election that they wanted medical marijuana, despite where you are on it. It's just that I think we should follow Mississippians, just like we followed Mississippians regarding the flag. And when the Supreme Court comes back and reverses that, and they reverses it based upon the law, then I think that we not only should be coming to a special session to address what they actually reverse, but also address the law that they're saying is unconstitutional. So that's what I think, because any other ballot initiative or citizen initiative going forward will have the same fate if we don't change that part of the Constitution as well.
Let me ask you this, should a member of the House or Senate who has got some current investments in that, or for a period of 4 or 5 years will have investments in that they're going to vote on, should they be prohibited from voting?
I don't really want to speak on it. I just think individual members, just like I've been there for going on 11 years, and when bills come up in committee and on the floor, members will vote present or they won't vote on issues that they have an interest in, and inevitably there's legislation that will affect.
I understand that.
A member's person.
Do you have some investments in that industry?
I do not.
Are you planning on it?
I do.
You are planning on having some investments?
Yes.
Okay.
Just like I invest in currently I invest in real estate. Currently I invest in the stock market. So they are.
Well, let me ask you this: will your investments increase if it moves from medical marijuana to recreational marijuana?
I haven't looked at that, but I believe that the volume, without taking a deep dive into the numbers, recreational has more volume than medical, and so I believe
I would think so.
Yeah,
let me ask you one more question on that one. Do you think if we had recreational marijuana, the Mississippi Delta, specifically the areas that you have?
Let's call it adult use. Let's use the term adult use.
Okay, well, but recreational use should be adult use. It'd be one and the same. I'm hoping. I'm not sure what you know, but would you think Bolivar County, Coahoma County, Washington counties would be a better place to raise a family if they had recreational marijuana?
I think that the policy that we put in place starting on 400 High Street determines how the quantity and the quality of life.
Good answer. That sounded like a good answer from a